It's estimated that in the United States, 250,000 people are HIV positive and don't know it. In Arizona, 3,000 to 5,000 people are HIV positive and they don't know it.
You know, I was under the impression, oh yeah, gay people and prostitutes and drug users, well, I'm not any of those. I was a straight A student, got a college degree, and it happened to me. So all that stuff is a bunch of myths. That's not true. It can happen to anyone.
HIV is not a gay disease. It has never been strictly a gay disease. It is a disease that affects and attacks all social realms of people, all minorities, all religions, all creeds. It doesn't matter who you are.
In the United States, 27% of the people living with HIV were infected through heterosexual sex. It can happen to anyone. Women are one of the most at-risk groups, especially African American women.
I was not in a relationship, but I had a known friend, and he was going to commit suicide, so he had asked me if I would come over and talk to him, and I did, and in the process I was molested, and that's how I got HIV.
We'd already been married for 5 years, so we took it upon ourselves to try to find, you know, maybe the person who had infected us. Was it me or was it him? And we couldn't find the person, so we kind of just said, you know what, it doesn't really matter how we got it or who gave it to us. It really matters, what are we going to do now?
Young people between the ages of 13 and 24 are being infected at an alarming rate. Most of them think that if they get infected, all they have to do is take one pill and everything will be okay.
I was well educated before being infected. What happened? I didn't follow my own advice.
The way that I was infected was my mom. She was having unprotected sex with a lot of people, and so one of the guys, I think he had it.
I was already treated differently because of being gay. Now I'm going to be treated differently because of my health status.
The kids at my school don't know, but some of the friends that I've been friends with for a really long time, they take it good and they treat me the same way that I should be as if I didn't have the disease.
I dropped out of school.
Older people are also highly at risk because they're used to using condoms as birth control, not to prevent HIV. HIV is still a very serious problem. It can wreak havoc on a person physically, psychologically, and emotionally, and the medications can only go so far and can cause serious damage to the internal organs.
Not only is your body affected, but your mind, your spirit, your finances for sure, because it's very, very costly.
Being Latin, Hispanic man, HIV positive, basically our culture, Mexican culture, does not really accept us for who we are.
HIV neuropathy is an extremely painful side effect of the disease. There's always a feeling of your hands and your feet being asleep, of being on fire, of being stuck with needles and pins. It was like somebody was taking a butcher knife and going through my kneecaps.
I did tell my mother when I first got diagnosed the very first day, but that didn't mean that I told my father.
I couldn't handle the stress. I was losing weight, losing my hair. It was a very stressful time.
I've experienced a lot of side effects, and this is my third regimen that I'm on now. And the first two were deadly to me, were toxic.
Shane needed a mom and dad, and so we're a good mom and dad, so we said, okay, let's have another kid. And then we adopted Shane about a year ago. It's been great. We love him very, very much.
People are still dying of AIDS. People are still testing positive. Preventing people from becoming HIV positive is the only cure that we have for new infections.
Using protection is the only prevention for HIV. And of course, abstinence.
In order to prevent the spread of HIV, you must use condoms, you must use all types of preventive measures.
HIV is here to stay, and until we find that cure, it's not going to go away.
Wait, I would say wait. That would have been my best words of advice. Sex is not something that you need in your teenage years. I found that out, and I'm still working through that myself.
It's not going away, it's just getting worse.
They shouldn't be racist against the people with HIV and AIDS just because they think that we have the disease and other people don't.
HIV is not about sex. It's a public health issue.
The AIDS Walk raises awareness about HIV and AIDS, and it is the best opportunity we have to raise awareness in our entire community. HIV and AIDS is a serious health problem, and it will continue to be until we do something about it.
The AIDS Walk is one of the most important things for the HIV community as far as education. It reaches out to teenagers from high school, which is so important to do. They are the ones that are the future. They are the ones that can stop this disease through education.
Without it, I mean, it'd be difficult for some of these organizations, such as Southwest Center for HIV and AIDS, to continue to survive.
The funds raised for the AIDS Walk are to support 16 HIV and AIDS agencies within our community.
Learning about HIV is extremely important in that it's educational, and education empowers you to know which direction you need to choose, which way you want to go in order to prevent the spread of it, and also it helps you to educate your family, your friends.
There's still never enough money to help everyone that we want to help. There's just never enough money. And so it's a great way to raise money, raise awareness, and bring people together.
Be smart, be safe, and get tested.
Be smart, be safe, get tested.
Be smart, be safe, and get tested.
Be smart, be safe, get tested.
Be smart, be safe, get tested.
Be smart, be safe, and get tested.